Degenerative myelopathy in dogs, comprehensive insights in management. Degenerative myelopathy, DM, is a devastating disease that affects dogs by progressively damaging their spinal cord, leading to severe mobility issues. Although early symptoms might resemble other medical conditions, understanding this genetic disorder allows dog owners to better recognize warning signs, such as limb weakness, and take steps to manage the disease effectively. By equipping themselves with knowledge, pet owners can enhance their dog's quality of life. What is degenerative myelopathy? Degenerative myelopathy, DM, is a progressive neurological disorder that primarily targets the white matter of the spinal cord, causing it to deteriorate. This degradation leads to rare limb weakness, eventually resulting in paralysis, and in advanced stages, it may also affect the front limbs. DM shares similarities with amyotrophic lateral sclerosis, ALS, in humans, commonly known as Lou Gehrig's disease. For pet owners, DM is especially distressing, as it robs dogs of their mobility and autonomy, significantly impacting daily activities. Recognizing the symptoms of degenerative myelopathy. DM symptoms are often subtle at first, making early detection challenging. Typically, signs emerge in dogs over the age of 8. As the disease progresses, these symptoms become more pronounced and easier to identify. Key symptoms include early-stage symptoms: swaying or wobbling of the hindquarters while standing, susceptibility to losing balance or falling with a slight push, clumsiness or staggering gait, dragging of the rear paws while walking, causing friction burns or skin irritation. Progressive symptoms: 1. Abnormal paw movements. Dogs may curl their rear paws under, walking on the tops of their feet instead of the pads. This behavior causes abrasions and fur loss on the knuckles. 2. Nail wear. Excessive wear on nails, particularly the rear claws, indicates difficulty in lifting the paws properly during walking. 3. Difficulty rising. Dogs with DM often struggle to stand up after lying down or sitting. Even once upright, their mobility is significantly impaired. 4. Impaired walking and stairs. Tasks like climbing stairs or squatting to relieve themselves become arduous. 5. Frequent falls. Advanced DM leads to dogs collapsing easily, even with minimal movement or pressure. 6. Paralysis. As the disease advances, paralysis of the hind limbs is inevitable. Eventually, the front limbs may also lose function, further immobilizing the dog. What causes degenerative myelopathy in dogs? DM is caused by a mutation in the SOD1, superoxide dismutase 1, gene, identified as the primary risk factor in 2009. This mutation disrupts the function of spinal cord cells, triggering the degenerative process. Dogs with 2 copies of the mutated gene, homozygous, are most at risk of developing the disease, while carriers with only 1 copy of the gene may remain unaffected but can pass the mutation to their offspring. Diagnosing degenerative myelopathy. Diagnosing DM can be complex, as its symptoms mimic other conditions. A thorough physical exam and several diagnostic tests are often required to rule out other potential causes of hind limb weakness. These include physical examination. Veterinarians assess reflexes, coordination, and overall mobility. Imaging tests. X-rays, CT scans, and MRIs help rule out spinal injuries, herniated discs, or tumors. Cerebrospinal fluid analysis, CSF. This test can detect inflammation or infection in the spinal cord. Spinal cord biopsy. Although rarely performed, this invasive procedure can confirm DM. Genetic testing. DNA testing for the SOD1 mutation is a non-invasive and increasingly popular method to confirm predisposition to DM, especially in high-risk breeds. Breeds prone to degenerative myelopathy. While DM can occur in any breed, certain breeds are genetically predisposed, including German Shepherd, Pembroke and Cardigan Welsh Corgis, Boxers, Chesapeake Bay Retrievers, Bernese Mountain Dogs, Rhodesian Ridgebacks, Shetland Sheepdogs, Poodles, Golden Retrievers, American Eskimo Dogs. Genetic screening is highly recommended for these breeds to identify carriers and affected individuals early. Treatment and management of degenerative myelopathy. Unfortunately, there is no cure for DM. The focus of treatment is on symptom management and maintaining the dog's quality of life. Exercise and physical therapy. Regular, low-impact activities such as swimming and leash walking can preserve muscle mass and mobility. Canine physical therapy, including stretching and balance exercises, is highly beneficial. Supportive equipment. Rear support harnesses enable owners to assist dogs with walking or climbing stairs. Booties or socks protect paws from abrasions caused by dragging. Wheelchairs designed for dogs can significantly improve mobility and independence in later stages. Home adjustments. Providing non-slip flooring or area rugs prevents falls. Ramps make it easier for dogs to access furniture or vehicles. Switching to a flat, easily accessible bed ensures comfort and safety. Preventing injuries. Walking on grass instead of hard surfaces minimizes wear and tear on paws. Frequent grooming of nails prevents additional discomfort from overgrown claws. Nutritional support. A balanced diet with added supplements, for example, omega-3 fatty acids, may promote joint and nervous system health. Prognosis and disease progression. DM is a progressive condition that worsens over time. After diagnosis, dogs typically experience a rapid decline in mobility. Paralysis of the hind limbs often occurs within 6 to 12 months, with front limb involvement following soon after. Additionally, dogs may lose bladder and bowel control in the advanced stages. Unfortunately, the disease eventually leads to complete immobility, leaving euthanasia as a humane option to prevent unnecessary suffering. Preventing degenerative myelopathy. The only effective prevention strategy is responsible breeding practices. Breeders of high-risk breeds should screen for the SOD1 gene mutation and avoid breeding dogs that carry the gene. Prospective dog owners should request genetic testing results when purchasing a puppy. Frequently asked questions about degenerative myelopathy. 1. When should I consider euthanasia for a dog with DM? Euthanasia becomes a consideration when the dog's quality of life declines significantly, such as complete immobility, chronic pain, or loss of bladder and bowel control. Consult your veterinarian for guidance during this difficult decision. 2. How can I care for a dog with DM at home? To improve your dog's comfort and mobility, invest in supportive equipment such as harnesses and wheelchairs. Provide a safe, accessible living environment with non-slip flooring and ramps. Incorporate regular physical therapy and maintain hygiene with treads and diapers if needed. 3. How long can a dog live with DM? Dogs diagnosed with DM typically live between 6 months and 3 years, depending on the speed of progression and the level of care provided. 4. How quickly does DM progress? The disease progresses relatively fast, with many dogs becoming paralyzed in their hind limbs within 1 year of diagnosis. Final thoughts. Degenerative myelopathy is a heartbreaking condition for dog owners. While there is no cure, early recognition and diligent management can significantly improve a dog's quality of life during the progression of the disease. Always consult a veterinarian for guidance and support tailored to your pet's needs. By staying informed, you can provide the best care possible for your beloved companion.